Hi.
Hi.
Spot. Hello, hello.
How are you?
Good.
Good.
How's it going?
Good. Busy morning so far.
Yeah.
Yes.
Same. I'm just looking over my presentation. So is this the right place? This is where we're supposed to be? Okay, good.
Yes.
Is it going to be live or just recorded?
Live and recorded, yeah.
Okay.
Yeah, we're recorded. I think it actually automatically starts recording once it starts.
Okay.
That's one of the main reasons why we switched, because this is now our second presentation that we're doing, or no, maybe third that we're doing on Teams. Because it helps with like tracking our attendance and it automatically starts recording.
Good.
Yes.
Okay.
Yeah, so we'll start right at 12 and give everyone else a few more minutes.
Perfect. Do you want me to go ahead and share my screen?
Yes.
All right, let me do that now. So I'm going to move this over here. Okay. Do you see the presentation or do you see? Okay.
Yeah, I see your presentation.
Okay, good. Not gonna work. Okay. So thank you for your help.
Of course.
It was very helpful. Very, very, very helpful. I just worked on it a little bit last night and a little bit this morning to get references in and
okay.
But yeah, very good.
Yes, you're welcome, of course.
Is Miss Winky coming?
I don't think so.
Okay.
She didn't tell me she was, and I think she's in teaching class right now. Yeah.
Okay.
I think she teaches till 12:30.
Okay.
Yeah, that I know of. She's never sat in on any of my presentations. Maybe she did the first time. I don't know. It's better when she does it.
It's better when she does it? Is that what you said?
Yeah. Yeah, it's not as nerve-wracking.
Are we going to take questions or just wait until the end?
Normally I don't really have too many people ask questions as I'm presenting, but when they do, if I see it in time, I'll stop and answer the question. But normally we definitely leave room at the end for questions.
Okay, just let me know if there's anything going on. Can you see the chat and everything?
Yes. Yeah.
Okay.
Yeah. I'll keep an eye out for the chat, and then I can unmute and let you know like if we have a question come through.
Yeah, I'll try to go kind of keep a good pace, and then yeah, if you need to stop me, just stop me.
Okay. I mean, it's right at 12, so I mean, we do have one member so far on the call, Margaret. If you want to go ahead and start now, I just don't know, I don't want to wait a few more.
What's it usually like? Do you usually have folks join a little bit later or not really?
Normally I usually have people log in right at 12 or, within like the first 2 minutes. So it's up to you. I just don't, I'm only saying that because I don't know how long your presentation, like, how long it would take you.
Yeah. Okay, no problem. Let me just find my presentation. trying to fix the screen. Just give me one sec.
Okay.
I'm in no hurry if you guys want to wait.
Oh, thank you. I'm gonna try to make this so I can see you, but also, there we go. Perfect though. Well, I'll go ahead and get started just because I do not know how long. I mean, it'll probably take right up to the hour, depending on who joins and want to leave room if there are some questions. So, and you're recording as well, so anybody can catch up. All right, well, so my name is Dr. Lauren Butler. I'm a registered dietitian, a nutrition epidemiologist, and an assistant professor in the nutrition and foods program here at Texas State. And today I will be talking about weight bias as part of the WellCats educational series. And more than that, though, I'll be talking about this whole new year, new you. You know, it's January, and I really want to take this opportunity to talk to you all about how weight bias fits into this culture of the new year and the new you idea. And so some of the objectives for today are that you will be able to consider your own history of dieting and weight loss at the completion of this session, to be able to define weight cycling and name one adverse health impact of weight cycling. And then hopefully you'll be able to understand how a weight inclusive practice works to end weight cycling. So first and foremost, what is weight bias? Well, weight bias is defined as negative judgments about someone based on their body size. Typically, weight bias is really centered on negative judgments around folks that live in larger bodies, living with overweight or living with obesity. Weight stigma is a little more nuanced. So when there is weight bias, this can lead to discriminatory acts, so actual actions and ideologies that are targeted towards larger bodied individuals due to this systemic weight bias. So what does that mean? This idea in our culture, at least in the US, that living in a larger body is bad, and that folks who live in larger bodies, typically there's ideas or biased ideas that those folks are lazy, they're not physically active, and this can actually lead to discrimination, such as in the workplace. So there is research that shows folks living in larger bodies, for example, are sometimes denied promotions or paid less than folks that are in thinner bodies. And so these are actual discriminatory actions are examples of weight stigma. And internalized weight stigma happens when a person who's experiencing these discriminatory actions actually internalizes this and accepts and absorbs these negative ideas and these discriminatory acts as being related to their weight and size, and accepts, yep, you know, I deserve this treatment. And they start to stigmatize themselves and have negative thoughts about their own body weight, shape, and size. So more about weight stigma, and why am I talking about this and going on and on about this? Because weight stigma has actually been linked to many negative psychological, physiological, and health outcomes that are adverse, right? That are negative health outcomes. So for example, research shows that weight stigma has been linked to increased cortisol, increased markers of inflammation, decreased physical activity, actually avoiding going to the gym and engaging in physical activities, avoidance of healthcare, declining screenings for cancer specifically, an inability to recall advice or instructions from providers, social isolation, eating disorders and disordered eating, and weight cycling and yo-yo dieting. So these are things that would really negatively impact someone, especially someone who's living in a larger body, right? In our society, we're told that living in a larger body, living with overweight, living with obesity is linked to things like increased risk of hypertension, increased risk of diabetes. So if someone is experiencing that and they're also experiencing weight stigma and not going to the healthcare for healthcare appointments, for example, then that would really perpetuate some of these negative health outcomes. And so for me, I have to ask myself, is it the weight stigma that's really causing these adverse health outcomes, or is it body weight, shape, and size, right? And how can we really know that? So more about weight stigma, that folks in larger bodies, patients in larger bodies report experiencing weight stigma in a variety of settings, including from their own doctors and other healthcare providers. So I don't know about you, but if I was experiencing that type of stigma from a doctor or healthcare provider, I would be reluctant to go in and seek care. More than 40% of US adults across a range of body sizes report experiencing some form of weight stigma in their day-to-day lives. And avoiding weight stigma is likely a major driver behind the great lengths that people in the US go to lose weight, right? So I started talking about New Year, New You, and I'll get back to that in a minute, but market data actually shows that Americans spent some $72.6 billion on weight loss products and programs in 2021. In addition, weight loss efforts start early. Research shows that nearly half of all high school students in the US report that they have tried a weight loss diet or tried to lose weight in some way. So yes, it's January 2024. Maybe you have already started a New Year's resolution and stopped. Maybe you are sticking with it. Maybe you're someone who has experienced starting these New Year's resolutions focused on weight loss, and you've done this several times in your life, right? And started the New Year's resolution and trying to lose weight and have not been able to maintain that weight loss and maintain that New Year's resolution. And if that's you, you are not alone. So the research shows that the probability of achieving weight loss is actually very low. So the annual probability for achieving normal body weight for those living with obesity has been found to be 1 in 10 for men and 1 in 124 for women. So research shows that if you're already in a BMI category that is aligned with living with obesity, your actual chances of achieving a normal body weight according to BMI is very low. If you are currently living in a BMI category that aligns with morbid obesity, the chances are even slimmer. So if that's the case, your chance of achieving a normal body weight for men is 1 in 1,290, and for women is only 1 in 677. And then some of us have heard, right, that ideal weight loss is about 5%. Sometimes folks talk about 10% weight loss. Well, in one research study, it was shown that just achieving a 5% weight loss in a year among those who are currently living with morbid obesity is only 1 in 12 for men and 1 in 10 for women. So these stats are not great. Why is it that weight loss is not sustainable? Why is it that we try these resolutions or make these commitments to lose weight, and for many of us can't seem to stick with it or can't seem to maintain the weight loss? Well, research also shows that successful long-term weight loss, which is often categorized, as I said, as either 10%, sometimes 5%, weight loss from initial body weight and then keeping it off for at least 1 year. In a review of 31 long-term studies on dieting, most individuals in these studies were actually unable to maintain their sustained weight loss. So 31 long-term studies showed that that most folks could not sustain this definition of weight loss. About 1/3 to 2/3 of dieters actually regained more weight than what they lost. And you may be someone going, yep, I've experienced that, or I know someone who's experienced that. They've lost weight, and then they end up gaining all of that weight back plus a little bit more. In a review of over 200,000 primary care electronic health records from the UK, among those participants who lost 5% of their body weight, greater than 50% had actually regained that weight back within 2 years, and 78% had regained that weight back within 5 years. So, and I have cited here a literature review that discusses this study, these two studies in particular, and also other studies that really show that although we have a lot of great ideas about how to lose weight and different interventions to try, that when it comes to dieting and lifestyle interventions, that weight loss is not really sustainable past that 2 to 5 year mark for most people. So it does say only 78%. So if you're one who has successfully achieved and maintained weight loss, then don't go away, because this presentation is going to talk about health behaviors in general that everyone can use. And we'll get there in a second. I just really want to help those folks who are sitting there going, should I try this again? Or maybe they're struggling with their New Year's resolution, and I want to give you some hope and encouragement. So talking a little bit more about why sustained weight loss is difficult. Well, first and foremost, genetics play a significant role in body weight. And when those who are genetically predisposed to higher weights attempt weight loss, they actually are also at higher risk of experiencing cycles of weight loss and weight regain. And this phenomenon is called weight cycling. Weight cycling in the research has been associated with it's psychologically disheartening and physiologically damaging. And that's what the research shows. And I'll give you some more stats on that in a second. After initial dieting success, many people, not just those who are genetically predisposed to living in a larger body weight, experience this plateau in continued weight loss. And this can also contribute to feelings of distress and feeling like a failure. And so there's a psychological phenomenon that's going on that makes it really difficult for folks to stay on this weight loss path. Additionally, when you start to lose weight, your body metabolically changes to store more energy, so that you to prevent wasting, and so that your tissues maintain homeostasis. Furthermore, caloric restriction actually heightens the appetite and decreases sensitivity to satiety cues. So what happens is, after being on a diet for a while, you get hungrier, your appetite is stronger, and when you eat, that decreased sensitivity to satiety means that you're more likely to overeat. So your body has all these ways of actually working against calorie restriction, which is one of the main methods of weight loss that folks tend to try in the US. The other thing is that there are these things called social determinants of health, right, that are not individual factors. These are social factors that are outside of an individual's control. And so I love this graph. I think it shows many of these social determinants of health that folks just can't control, that actually do impact their ability to follow recommendations to eat less and increase physical activity, which again are two of the top strategies recommended for folks to lose weight. So if you see things like, let's see, gender, right? Something you can't change, but folks may experience social marginalization or discrimination that makes it difficult to engage in these individual health behaviors. Access to health services, and biology and genetic endowment, those are things that we can't change. And then the healthy child development. So if things happen in childhood to adults that we can't go back and redo the events of our childhood, that may actually have long-lasting consequences on our health and body weight, shape, and size. So it's really important that we also think about those outside factors that we can't control that really do impact our ability to make and sustain health behavior changes. And so that's why it's really important to those of us who can, to advocate for social change, political change that helps to support equal access and policies that help to support equal access to healthcare and the best and most benefit for all in terms of achieving health behavior change. So really, we talked about why it's not sustainable and the research actually that shows what happens when folks do attempt weight loss. What I also want to talk to you a little bit about is this question of, are there actually adverse health implications associated with weight loss attempts? And what the research says is yes. So I mentioned weight cycling earlier, and there actually are some adverse health consequences associated with weight cycling. Attempting weight loss, particularly calorie restriction, is associated with increase of eating disorders. And there's this heightened weight stigma that is associated with intentional weight loss, which I talked to you a little bit about earlier of the what the negative impacts of weight stigma are. So the answer to that question is yes, we know there's some adverse physical and psychological health outcomes and physiological health outcomes associated with weight stigma that occurs as a part of intentional weight loss. Let's talk a little bit more, though, about weight cycling, because this is something that folks often experience if they've really been in this pattern of weight loss and weight gain in their life, and chronic dieting, meaning, you've tried several different diets, cabbage soup diet, keto diet, every new diet you're trying really desperately to lose weight. And so what happens with weight cycling is that there's typically some weight gain, or you're at a point in your body weight, shape, or size that is large, and you're feeling unhappy with that. And so there's diet and restriction that usually happens, and weight loss does typically occur. This, though, is also associated with feelings of deprivation and some of those metabolic consequences that I talked about earlier, and changes in hunger and satiety. However, you'll still experience weight loss. And eventually, though, for most people at some point, whether it be within a month or within a year or within 5 years, they can't maintain that cycle. And so that's when that overeating, what I like to call compensation behavior, typically occurs after a period of restriction where your body is going, yes, I'm finally able to eat regularly again, and let me make sure I eat enough in case another calorie restriction happens. I'll make sure that this body is well protected against starvation. And so your body's really trying to protect you. The body doesn't understand why weight loss is occurring, right? Our body doesn't know if it's because we're intentionally trying to lose weight, or maybe because we're sick, or we're living in an area where we don't have access to food. So our body's really going to respond to calorie restriction and weight loss the same, regardless of what our external experience is. So that compensation eating leads to weight gain. There's feelings of shame. The research shows that these feelings of shame may be associated with binge eating. And so again, more weight gain, negative thoughts, negative thinking, and that might lead to more weight gain. And then the person says, okay, let me start this cycle all the way over again. So really, folks who have experienced this are sometimes, can reach a point, at least my clients did that I worked with, where they were tired of this cycle and they really wanted to get out of this cycle. The thing is, with weight cycling, it can be dangerous. In the research, weight cycling has been associated with higher mortality rates, higher risk of fractures due to osteoporosis, gallstone attacks, loss of muscle mass. Weight cycling has also been associated with hypertension and chronic inflammation, and even some types of cancer, including renal cell carcinoma and endometrial cancer. So there really are some very negative impacts of weight cycling, and there's a lot of great research that talks about why that is and what the physiology is underlying these changes, the weight gain, the weight loss, the weight gain, the weight loss that may be related to, that are mechanistic to these adverse outcomes. The other thing is that individuals who are already living in larger bodies often begin attempting weight loss in their youth and experience several weight cycles in their lifetime. So they're undergoing weight cycling several times. And research shows, that can have this cumulative effect with these negative health outcomes that I've already mentioned. So it seems like those who may be most vulnerable to the health outcomes that are associated with living with overweight and obesity are also most vulnerable to these adverse impacts of weight cycling. And in my mind, I'm thinking, okay, well, how do we stop this? As a registered dietitian, my first thought when I learned about this was, wow, how can I help those people who are already living in larger bodies and dealing with some of the health concerns that are associated with that, also now experiencing weight cycling, which is potentially damaging to their health. That seems kind of like a double burden to me. So the question, how do you avoid weight cycling? Or for me, it was, how do I help my patients and clients to avoid weight cycling? Well, there is a solution. First and foremost, research shows that reduced risk of death and improved clinical indicators of health are possible without weight loss, right? So shifting that focus away from weight loss and shifting it towards health behaviors without tracking weight or thinking about weight so we don't undergo those psychological demoralizations if we're not losing weight can be really helpful. So what research shows is that routine physical activity, fruit and vegetable consumption, and abstaining from smoking, for example, have all been associated with lower risk of all-cause mortality, regardless of weight, right? Dietary modifications, again, smoking cessation, reducing stress, and alcohol use have also been associated with improvements specifically in blood pressure and cholesterol. And there was another study that looked at the number of positive health behaviors that someone was engaged in and found that the higher the number of health behaviors, the lower the risk of mortality. Many of these studies have shown robust relationships between the health behaviors, morbidity, and mortality, even when controlling for body mass index or weight. So meaning whether or not someone's losing weight, if they're engaging in these behaviors, they are reaping health benefits and also potentially at reduced risk of mortality and morbidity. And lastly, the Diabetes Prevention Program, a very well-known diabetes program in the US, has there's been research from that study showing that physical activity independent of weight loss is an independent predictor of the prevention of diabetes. So that means engaging in regular physical activity could help to prevent diabetes, again, regardless of whether or not somebody loses weight. So that's good news for folks who have been engaging in chronic dieting, who have undergone several cycles of weight loss, meaning, you know, we can shift the focus to health behaviors and reap benefits without focusing on the number on the scale. A weight-inclusive approach is an approach that does just that. So really focuses on well-being rather than the number on the scale or counting calories. A weight-inclusive approach is sometimes called a weight-neutral approach. And this approach really assumes that everyone is capable of achieving health and well-being independent of weight. So hearkening back to those research studies that I just mentioned. And a weight-neutral or weight-inclusive approach has the assumption that this can happen if folks are given access to non-stigmatizing healthcare. A weight-inclusive approach challenges the belief that weight is a health behavior, right? So weight is not a health behavior, or weight loss is not a health behavior. It's not something that I can just do, right? Health behavior is something like physical activity. Right now, I could do 5 jumping jacks, right? But if I said to myself, okay, self, right now, lose 5 pounds. I can't do that, right? So again, a weight-inclusive approach really focuses on things that we can do in actual health behaviors rather than counting calories, counting pounds on the scale. A weight-inclusive approach emphasizes emotional and physical wellness over the pursuit of a lower weight, and it advocates for the removal of stigma experienced by persons living in larger bodies. Components of a weight-inclusive approach include non-diet strategies that emphasize awareness of hunger and fullness cues. So things like intuitive eating, if you've heard of that, it's pretty popular over the past, I'd say, 5 to 10 years. Really thinking about, am I hungry? Am I full? Using things like a hunger and fullness scale to help support healthful dietary patterns and intake. Also focusing on lifestyle behaviors like encouraging ample sleep, reducing alcohol and marijuana use, especially with legislation, you know, making marijuana legal in some places. It's important that as a healthcare provider, I start asking my patients and clients about marijuana use and even alcohol use. I've had clients say to me, you know, no one's really ever talked to me about how alcohol use is impacting my relationship with food. A weight-inclusive approach also advocates for self-care and promoting stress management and support group utilization. There's many free support groups, 12-step groups, and other types of support groups in our country that folks can utilize to help with stress management. A weight-inclusive approach focuses on movement that is enjoyable and accessible for all people. So really thinking about physical activities that people of all sizes and abilities can participate in. And this is really important for folks who are living in larger bodies to think about if you've always been a part of physical activity just for the goal of losing weight, right? Thinking about activities that you can engage in without weight loss being the goal, making that activity likely to be something that you will continue doing, and that because you enjoy it, right? And a weight-inclusive approach typically advocates for people to feel less pressure, as I've said many times, to reach a goal and be more focused on the process of improving their overall well-being. So there is evidence to show benefits of a weight-inclusive approach. Some of those benefits are improvements in blood pressure, improvements in eating behaviors such as decreased episodes of binge eating, and improvements and increased use of intuitive eating, and also improvements to psychological health, including reduced incidences of depression, improvements in body image, and reductions in weight stigma, which, as I mentioned earlier, are associated with their own set of negative health outcomes. One type of weight-inclusive approach, it's not the only type, but one type is the health at every size approach. This approach is actually rooted in fat activism of the 1960s. And yes, I did say fat, that word, because fat activists have said that they want to reclaim that word and they're comfortable using that word. Although I will say some of my clients don't like to use that word, and so I usually give folks the autonomy and choice to say if they want to use it or not. Nevertheless, the health at every size approach is rooted in this fat activist movement. It is created by the Association for Size Diversity and Health. And it actually is a weight-inclusive approach that resulted from discussions between healthcare workers, consumers, and activists who reject the use of weight and BMI as a proxy for health, and who also reject the myth that weight is a result of personal choices, independent of these uncontrollable outside factors. Did we have a question? Bless you.
Thank you.
Great. So the health at every size approach, going back to when I was talking about social determinants of health, really does acknowledge that there's these outside factors that can impact our ability to engage in health behaviors, and that is important. And one other note about BMI, if you're not aware, oh my goodness, I'm drawing a blank here. American Medical Association recently over the summer put out their own statement about not using BMI as an indicator of clinical health. And so things are really changing around the use of BMI as a health indicator. You may already be aware of that. So more about health at every size. There are published studies showing evidence for the use of a health at every size approach. For example, one review of 6 RCTs, or randomized controlled trials that all used health at every size principles, found that the health at every size approach was statistically and clinically successful in improving physiological measures such as blood pressure, physical activity, and markers of self-esteem, and improving disordered eating. So the health at every size approach has been shown to have these benefits. In one of those RCTs, the participants of the health at every size based group versus a dieting for weight loss group actually showed more positive improvements, including decreased total cholesterol levels, LDL levels, triglycerides, and systolic blood pressure after 2 years. So the folks who were in the health at every size based group had this long-term change of 2 years, at least during that follow-up period, that they had more significant improvements in those cardiometabolic indicators. And participants utilizing the health at every size based approaches also showed improvements to body image, decreased eating restraint, physical hunger rating, and decreased bulimic symptomology. So decreasing those disordered eating behaviors. So there is evidence showing that this approach can be beneficial for health, again, regardless of whether someone is losing weight and without those negative impacts of weight stigma and weight cycling that I talked about before, which I think is really important. So what are some weight-inclusive practices that you can try doing today or that you can think about, right? So weight-inclusive practices include focusing on eating for well-being. So things like asking yourself, am I eating 3 meals a day? Am I getting all 5 food groups in when I have a meal, or at least am I getting all 5 food groups in one day? These are things that are different than dieting and that also support a healthy relationship with food and support overall well-being. You can think about intuitive eating practices, which mean paying attention to hunger and fullness cues. And there's many other components to intuitive eating. There's a whole book on intuitive eating. But first things first is just, listening to your body. Am I hungry? Am I full? Not even trying to stop or start eating, but just getting in tune with that. Some folks don't know really what hunger and fullness feels like, especially if you're a chronic dieter, somebody who's been through these cycles that I was talking about earlier with restriction and compensation eating. That can really impact your body's ability to sense hunger and fullness. Weight inclusive practices also emphasize flexible individual eating patterns that are based on nutritional needs and pleasure, saying, it's okay to have foods that might be part of a pleasurable experience. And what happens and what we see, what I have seen in the clinical setting, is as folks practice these principles, they become less obsessed and concerned with certain foods that maybe in the past they would say, I can't even have that in my house. It's quite amazing how weight inclusive practices and non-diet practices work in that way to heal folks' relationships with food. And so another component of weight inclusive practices around nutrition is emphasizing adding healthful foods in. So really just focusing on that, not focusing on replacing, not focusing on restricting or reducing anything, but really setting goals for yourself that involve increasing and adding in healthful foods such as fruits and vegetables, sources of healthy fats, complex carbohydrates, drinking more water. Even I've worked with folks just on increasing high fiber foods and adding one high fiber food to their diet every day. Other examples of weight inclusive practices are, like I said before, focusing on enjoyable movement or life enhancing movement and physical activities that really allow people of all sizes and all abilities and all interests to participate. And actually allow for folks to participate in physical activity to the degree that they feel comfortable and they choose. And so you can see in the photo there, I've done that once or twice in my life, but it's an enjoyable activity. I don't remember what this activity is called, where you hold that canvas up and kind of walk around in a circle. But the focus here is not about losing weight and, that kind of gym culture mentality. It's just about being active and moving your body. And especially for folks who have really had some trauma around exercise, where they've only exercised to lose weight and only exercised to the extreme, sometimes experiencing pain, there can be episodes of over-exercise and then not exercising at all in their life. And so this is really an alternative to help heal that relationship with exercise, not necessarily this canvas activity, but in involving yourself in things that are just enjoyable with less pressure. And then another weight inclusive practice is really seeking out healthcare professionals that are competent and utilize practices that reduce the perpetuation of weight stigma and incidences of weight cycling. And the way you can do that is by calling and asking questions of the provider before you see them, maybe talking to them about your history of weight loss and weight regain and saying, hey, can we just focus on health behavior change rather than strict monitoring of my weight? And, if they want to monitor your weight, maybe asking, can we do a blind weight check where you just step on the scale backwards and you don't have to look at the number, but your doctor can still have that number if there are any weight related concerns that are going on. So there are definitely ways to be less stigmatizing in healthcare. And there are actually many providers, dietitians, counselors, psychologists that are adopting some of these weight inclusive practices. So other things you can do is really identify your own biases and prejudices by practicing self-awareness. So you can ask yourself questions like, how do I feel when I work with persons of different body sizes? Do I make assumptions regarding a person's character, their intelligence, abilities, health status, or behaviors only based on their weight? What stereotypes do I have about persons who are living with obesity? How do those feelings, how do those affected by obesity feel when they leave my presence? And one thing you could do is, just looking at this picture, what does that bring up for you? There's several folks there in larger bodies, they're having a good time, they're enjoying life. And for some folks, there's a real negative reaction to that. And that's a part of weight bias and weight stigma. And those are things that we can become more self-aware of and start to work through so that everyone, including yourself, if you're someone who's experienced this, can start to feel comfortable living a full life and engaging in activities and especially health supporting and health promoting behaviors. So really thinking about freeing yourself from weight obsession, if you're someone who's lived with that, if you're someone who's lived in the US, then you've likely been at least exposed to that in some way. If you look at media and advertising in our country, we definitely see this focus on thinness and youth as being ideal and prioritized. And so learn to start looking at those images with a critical eye, right? Especially now with all of the different filters and things that can happen. A lot of those images are not true to light and not true to what's really happening. They've been touched up. And in some cases, there are folks who are representatives or influencers and are engaging in some unhealthy behaviors themselves. So we can't always look and say, oh, because someone's thin, that they're engaging in a healthy lifestyle. Don't let yourself be duped by diet scams, right? So again, talking about this new year, new you thing, do you really want to start another diet, or do you want to maybe try a different route this time, focusing on health behaviors and overall well-being? And think critically about weight loss programs. Is this something that is promoting things that are going to be sustainable, that are going to be less stigmatizing? Is that something that's important to you? Do you want to end the cycle of weight loss and weight gain that maybe you've experienced? Overcome your own negative body image. Many of us, regardless of your body weight, shape, and size, have some negative thoughts about our body, and maybe just every once in a while, but some of us have those thoughts every day and quite often. And you can also learn to start practicing weight inclusivity using any of these practices that I've mentioned. So in summary, just some takeaway key points that I hope you'll think about is that weight cycling is associated with adverse health outcomes. Weight inclusive approaches work to end chronic weight loss attempts and the harms of weight cycling. And you can start to use weight inclusive practices today. Thank you, and I will take any questions or feedback that you have. Oh, we have a large audience now. That's great.
Any questions? No?
Where do you stand on the Ozempic, shots, that procedure to try to lose weight? Do you find that there's data already on weight gain after getting off of that? And what do you think about that?
Oh, thanks, Melissa. That's such a great question. As a practitioner, my thought is if someone comes to me and they want to try Ozempic, my philosophy is, or any of those weight loss, medications that are out, is that I want to support autonomy in healthcare, right? So I will provide them with the information I know about these types of weight loss medications. And what I do know is that I actually just attended the Food and Nutrition Conference Expo in Colorado this year, and there was a panel on this. And what the doctor presenting on this said is, and she was in favor of this, right? She works for a company where they focus on weight loss using medications, that you have to stay on Ozempic and other weight loss medications for life, or you will gain the weight back. And to me, the folks that I work with, that's not realistic for my clients and patients to stay on medications, just because most of them don't have adequate access to healthcare to be able to stay on drugs like that for life. If you stop taking it, you will regain the weight. Just like if you stop taking any type of appetite suppressant, you're going to regain the weight. I don't believe we have studies that show the long-term effects specifically with Ozempic and some of those other semaglutides and other medications. But that is another concern, is I think there's more, at least case study and reports of people talking about these negative consequences like their hair falling out. And the reason their hair is falling out is because they're also experiencing nutrient inadequacies. So there's been a lot of reports of folks about just inadequate nutrition, not being able to eat, feeling very sick, not being able to engage in a full life. But according to the woman in Colorado, you know, if you have a team, a doctor, a dietitian, I think they also mentioned a counselor, like they have a whole team of folks who really support their patients that are taking that medication, and they really work with them to try to tweak it. And so if you have that intensive care team, it probably reduces some of these negative side effects. But great question.
Thank you. And sorry again for the sneezes. I didn't realize I had unmuted myself.
That's okay. I was happy to bless you. Yeah, that's a great question. Other questions? I would love to talk more about anything that came up for you all. Sometimes this can be a hard topic. Most of the people that I worked with in my private practice before coming to Texas State were living in larger bodies and were currently living with disordered eating, or just had several cycles of weight loss and weight gain, what I would call chronic dieting and weight cycling. And so for folks who had really gone down that path for most of their lives, they were looking for something different. And I think weight inclusive practices can be a great fit for folks who are just kind of fed up with the dieting cycle. So it may not be for everybody. You know, if that hasn't been your experience, then and you found something that works in this for you, then this may not be the approach. But I feel like we all know somebody who's had that experience right in their life where they've gained weight and lost weight and gained weight and lost weight, and we see our loved ones struggling. And so they really may be a good fit for a weight inclusive approach to help them kind of get off of that bandwagon and feel like they can participate in life. Because that was the other thing with my patients. They were not wanting to date. They were not wanting to apply for jobs. They were not wanting to, they didn't want to go to the gym. They didn't want to be in public because of their body, you know, and I think that that's really sad. But imagine if every time you went out, you were getting comments and side eyes. And, you know, even if you were trying to do something good for your health, like go to the gym or go to the doctor, you were constantly being bombarded with messages about needing to lose weight. And those were some of the sad stories that I heard. So again, I really think this can be a helpful approach to take. And there's research to support it too. So yeah, great.
Any other questions? Okay, well, thank you so much, Dr. Butler, for joining us today. I really appreciate you taking the time to educate all of us on this topic. It was a lot of information, but it's really appreciated.
Yeah, you're welcome. If anybody has questions or needs additional resources, please don't hesitate to reach out. I can put my contact information in the chat.
All right, well, I hope everyone has a great day. Thank you.
Thank you, Melissa. Here's my email address if anybody wants to talk more.
All right, bye, Dr. Butler. Thank you again so much. I really appreciate it.
Yeah, you're welcome. Thank you for the invite. Have a great day.
Of course, you're welcome. Have a good day.
Bye.
Thank you.